Once thought to only be relevant to medical research in certain specialties such as neurosurgery and cardiology, regenerative medicine is an emerging field that is finding its way into some seemingly unlikely places. Here's plastic surgeon Dr. Andrew Wolin with more.
The entire field of stem cell research is really called regenerative medicine. Regenerative really means the capacity to actually regrow tissue, regrow new tissue. And regenerative medicine has always been in the realm of the neurosurgeons and the cardiac surgeons and things like that, looking for ways to counteract chronic neurological diseases and chronic heart disease. Scientists have been going to a person's bone marrow when they need primitive cells to repopulate the body, such as during a treatment for multiple myeloma and things like that. In the last 10 years, scientists have found that the fat in your body contains similar stem cells to the stem cells that they originally were culturing from the bone marrow. We as plastic surgeons now have become front runners in this stem cell race because the fat that we used to extract and discard during liposuction can be used to make people's features more youthful. The face, the eyes, the chin, the mouth, and the hands. The utilization of the fat and stem cells in the hands is a fantastic way to use your natural material to rejuvenate an area that really in the past did not have very many options. There are a lot of patients who have these large veins of the hand. We call them just senescent veins, old people veins. Young people can have them too, but it's showing a lot of veins in the top of the hands and not as much skin and thickness of skin to hide those veins. So what this fat transfer also does, not just volumizes, but it camouflages a lot of that veiny look to the hands. And for a lot of people, that's a fantastic gain. Now, patients can come in and with a little bit of fat that we can take from the thighs or from the flank or wherever the patient is willing to give it to us from, we can take that fat gently out. We can then centrifuge it and put it in small syringes and then inject it with fine little cannulas and fill the entire area of the top of the hands up to the wrist and even down to the top of the fingers. The aesthetic community really has no scientific proof that it's absolutely the stem cells that are doing this rejuvenating type of activity. But by preparing the fat in a very gentle way, by removing it from the areas of the lower extremity and then gently preparing it and centrifuging it and then re-injecting it, I think we have found not just an improvement in the volumization, which obviously also improves the youthful look, but also an improvement in the texture, in the tone, and in the general behavior of the skin, the turgor, the feel. It looks and feels different. We know that empirically it's different, but we just don't have the absolute scientific proof to tell exactly why that happens.